I'll just kind of show you, I'll click through these, the diversity of implants that we do at Restore 3D that might be a little bit of inspiration and lead to maybe some good discussion at the end to just show you how this technology, additive manufacturing in orthopedics can be just applied across the entire body. So as I click here, you can kind of just see the range of implants that we have done as a company. These are all Restore 3D devices. Where surgeons bring to us complex or unique clinical cases, and we partner with them utilizing additive as well as some other digital design tools to be able to treat these patients.
You can make microfluidic circuits, so sort of classic mixing circuits. You can make some more elaborate mixing circuits, some fairly elaborate capillary-like structures, droplet injectors, etc.
Did was we took the trabecular pattern of bone and applied it to a pedicle screw situation. And as you screw in the screw, bone collects within those pores, creating a biological ripple effect in and of itself, just with the hardware alone. However, we have the unique ability to draw in bone marrow for diagnostic purposes, but also to re-inject it for therapeutic purposes.
This is the kind of custom implant that we can design, and the principles of this implant are similar to the previous case that I showed you. We work out which bit of bone we need to resect. We design the plate using the same principle. We know where the screws are going to be, we know where the plate's going to be, we know what shape we want the leg to be, we know which section of bone we want to take out. So we design the plate accordingly, and we use guides to do the osteotomies and to drill the pilot holes for the screws. This is the plate. My engineers are absolutely amazing at creating these, and these are not easy to make or design. So
at COSM, we're building a product solution that makes women's health personalized and predictive, with AI and 3D printing at its core. We're developing the world's first digital gynecology platform with image-based diagnosis, AI-generated personalization, secure cloud software, like Greg mentioned, that enable 3D printing to manufacture patient-specific gynaecologic devices.
Here's a little video of how it works. So this is a video from recorded within the printer. So there's a camera in the printer, and this is real time. I did cut off the first 20 seconds of this video because you just have the vial rotating. What you don't see here is the light that is projecting these tomographic patterns, but what you do see is that the object, in this case the model of a rat artery, not to scale, it's a little bigger, is being printed.
The benefits of pharmaceutical 3D printing. When we are talking about pharmaceutical 3D printing, we are talking about a layer by layer process, additive manufacturing, and in this process, thanks to this process, we can print formulations like oral dosage forms, we can print implantable devices that we can insert in the body and release drug during months or weeks.
We use certified cells and initiate a cell replication process. We add the cells to biomaterials to prepare our bioink, specifically bioink. This bioink is loaded into the bioprinter, simple bioprinters, which layer by layer build our derm-like tissue. Over 6 days, these 3D tissues produce collagen and the other proteins, such as elastin, fibronectin, and glycosaminoglycans itself.
And the beauty of that is that basically it makes the gel macroscopically stiffer. So now if we print these wheels, if we make it with normal gel, not 5% weight per volume, they collapse under their own weight. But with this material, they're able to withstand their own weight, and we can print them very nicely. But at the microscopic level, the cell level forces, cells are able to break these bonds with minimal integrin-mediated stresses, and therefore they can migrate.
And some of the things that really kind of get me going and a fun project that we've had for some pediatric prosthetics. So this was we will do a dual material printing, where we'll do a inner flexible that's a TPU, and then we'll integrate a PA12 struts into that. And then with those PA12 struts, this is where kiddo that beat the snot out of this, where on top of the PA12, and then that can be integrated right into the prosthesis to give it even more strength to it, and then also for cosmetic purposes as well, where it's a fun thing that the kid wants to wear and wants to proceed with it. Where this kiddo basically came back and that thing was just shredded, as far as overall the use that thing got. And it was kind of funny where the clinician said, "Hey, can we make another one of these?" I said, "Yeah, of course." We reprinted it, made it just a little bit bigger in speed areas of a new scan that we got sent, and boom, whole new prosthesis for the kiddo to wear and to beat up again, because that's what kids do.
Virtual reality is amazing because, just as Dr. Ashwath showed, you can step into the model. This is the same 3D segmented model that we've already made in Mimics, but now we've put it into the Elucys viewing system. As you know, in virtual reality, you can do many things that we couldn't do even with the physical 3D model. You have unlimited cut planes. You can look at the anatomy in very unique ways that we would never be able to do in the OR.
And the small footprint is something that always kind of exciting to see, and we keep discovering how families actually can use it. So bicycle trails, they use them also as an insert for strollers, because most of the strollers are not supportive enough. It's so small that it can fit in different swings. They can use them on airlines, and we are so excited that sometimes those families discovering new opportunities that never been possible because of the size of other products. So like sleds and mobility, it's one of those things.